At the European level, several bodies work for more health and safety at the workplace. Trade unions and employers discuss health and safety issues in the social dialogue committees. The social partners also have their say in advisory committees to the European Commission, and they are represented in the European Union's agency, EU OSHA. So the European Union level is important to secure a good level of health and safety at work in all member states. Many regulations of health and safety have an EU origin. It is important to better connect the national and the EU level.
Care workers in both hospital and social services sectors are represented by EPSU at the EU level, while employers in these sectors are represented by HOSPIM and the social employers. These organizations have long-lasting cooperation in European social dialogue structures to discuss and negotiate various pieces of regulations. There are a number of tangible results introducing protection of care workers in terms of health and safety. This includes, for example, Social Partners Framework Agreement on Prevention from Sharp Injuries in the hospital and healthcare sector that has been transformed later on into a directive. Another example of these regulations is the amendment to the directive on carcinogens, mutagens or reprotoxic substances at work, and developing guidance on the safe management of hazardous medicinal products. Currently, social partners work on recognizing COVID-19 as an occupational disease, which would allow for better protection, especially in health and social care services.
Despite many initiatives to improve health and safety in the caring professions undertaken by the social partners themselves and also by the European Commission, there are still many issues to be addressed. Institutions from the European level could play more of a moderating and coordinating role in national or even cross-border activities.
There is still a lack of cross-border coordination between social partners' initiatives, which hinders the integration of national and EU level efforts. While those involved in the work at the EU level are committed and emphasize its importance, activities in the EU level social dialogue are often disconnected from the national level in member states. National representatives of trade unions and employer associations have limited knowledge of the relevance and impact of EU-level activities in the respective countries, which may explain the lack of cross-border cooperation between member states and between the EU and the national levels.
In the HEROES study reports, you can read more about the national and the European Union level.